Hello, welcome to the University of California, San Diego Chronic Kidney Disease Program. My name is Norma Regev, and I am a licensed clinical social worker. Our healthcare team includes a nephrologist, pharmacist, nurse, social worker, and a dietitian. My role is to help educate patients learn about kidney disease and the treatment options available to them. This is one module of a 6-part series discussing treatment options for failing kidneys. In this module, I will talk about hemodialysis. Our goal is to help empower you with knowledge to make informed decisions about your kidney treatment choices. We know that needing to consider kidney treatment options can be a big decision. It gives some people hope to know that there are treatments today that can help them live long, well, and maintain a good quality of life. Hemodialysis is one of those options. In addition to medications and dietary recommendations, your doctor will help you choose what treatment is best for you based on your current health and treatment goals. There are 3 main types of treatment for failing kidneys. Those include transplant, hemodialysis, both done in-center and at home, and peritoneal dialysis, and finally, conservative management. In this module, we will be discussing hemodialysis. When should I start dialysis? Good question. You and your kidney doctor will decide when to start based on your labs, kidney function, and if you have severe symptoms caused by your kidney disease, such as shortness of breath, fatigue, swelling, muscle cramps, nausea or vomiting, or having a metallic taste in your mouth. What is dialysis? Dialysis is a procedure used to treat kidney failure. It does some of the things a normal kidney does, like removing extra water from the body and removing the waste products that have built up in the blood. For hemodialysis, there are 2 types, in-center and at home. I will talk more about each type in just a minute, but first, let's talk about how dialysis works. Hemodialysis uses an artificial kidney called a dialyzer and a machine. The dialysis technicians will place needles into your dialysis access located in your arm. Blood is pumped through the dialyzer where extra water and waste products are removed. Plastic tubes carry blood out of the body, through the dialyzer, and back into the body after it has been cleaned. Hemodialysis is usually done 3 times a week for 3.5 to 5 hours each treatment. It is done at a dialysis center where nurses and technicians do your treatments for you. It can also be done at home where you and your care partner do your treatment together. There are a few considerations with in-center hemodialysis. You'll have the reassurance of staff-assisted treatment. You can ask questions face-to-face whenever you're there. All of your treatments, labs, and checkups will be done in one place. The schedule is more predictable. There is a lot of community choice for center locations, and you will need to arrange for your own transportation to and from the dialysis center. Here is Pamela McDaniels, an in-center hemodialysis patient.
I chose hemodialysis because I didn't want to dialyze at night, because I wanted someone there with me that was a nurse, and I didn't have that exposure, so I chose to go to the hospital.
What led up to beginning in-center hemodialysis?
Well, my body was just out of sorts, and I didn't know why it was, so I said, I know what I have to do, because I was living with my sister and my brother-in-law in Coronado, because he's in the Navy. So I said, let me just take the bus and go to the hospital, which is UCSD Hillcrest. And they tell me that I had to have a blood transfusion, and because my body was out of sorts. And so when I gave them the specimen, a urine specimen, they came back and told me that I was in renal failure.
How has your life changed since starting in-center hemodialysis?
Well, I chose to go early in the morning, and it wasn't available, but when it was, I just became enmeshed with the staff. I used to be a drug counselor, So I've been that person that's always helped people. And so I helped the new patients, the nurses and doctors. They told me things that I had to ask questions, how come and what for. And I just accepted it. I trust the techs and the nurses. I ask my questions and they answer me. And I'm grateful with that. You have to have a relationship, a rapport with the staff, with your doctor, primarily with your doctor. You have to ask the questions if your body is out of sort. You can't just let it go. You can't. Because if you do, then you find out that your body is out of sorts. So I tell every friends to ask questions about their body. The patients that are in dialysis, ask questions. You have to ask questions. We have labs done every week. If your body's is out of sorts, you have to ask questions and respect the answer from the person you're asking. You have to, especially being on dialysis. Like I'm a big baby, and I have yet to look at my needles when they stick me, when they're getting ready to put me on the machines. And it'll hurt a little bit, but it's just a minute. And so 3.5 hours, you have your earphones, you're getting to watch TV, and if you're good, you can go to sleep. And next thing you know, they'll tell you, Miss Pam, you got so many minutes, and then you know the whole process to getting out the machine. Sometimes people, and I do have to have a nap afterwards, but not all the time, especially if I have to do things. But a lot of people, they're tired. I have things to do. Now, after that's done, then I'll take my nap. But you have to pay attention. Again, pay attention to your body, how it's feeling, and always ask questions, always.
Hemodialysis at home is very similar to in-center hemodialysis, only it's done in the comfort of your own home with slightly different equipment. There are some pros and cons related to home hemodialysis. The pros are, you can schedule your treatment around your life. You will have the ability to have fewer food and drink restrictions, take fewer medications, keep your social, school, or work life more flexible, and you and your care partner are the ones doing your treatment so you can have more control. The cons include, it will take approximately 6 to 8 weeks of in-center teaching before you can start doing your dialysis at home. You will need space to store supplies. You will not be able to see and talk to the doctors and nurses as often. And finally, your care partner is the one responsible for inserting the needles into your dialysis access in order to perform your dialysis treatment. Here's David and Jacos, a home hemodialysis patient.
So I chose home hemodialysis after initially being on home peritoneal dialysis. I eventually got so many infections with peritoneal dialysis that I could no longer use it because the area, the peritoneum, wasn't healthy enough to be used anymore. So I had to transition from that to a home hemodialysis. That was probably when I was 12 years old, and I've been on it since then, so it's like 14 years now that I've been on home hemodialysis. One of the reasons why I love being on home dialysis, regardless of option, is that it gives you a lot more freedom. You don't have to be on someone else's time. You don't have to, you can make your own decisions, a little more independent. When it comes specifically to hemodialysis, I enjoyed the fact that it would give me the option of having a more free diet. Right now, I do home hemodialysis 4 times a week for 4 hours, which is 16 hours a week. It's more than the 9 hours most patients get. And because of that and the meds I'm on, I have very little restrictions on my diet. That's one of the biggest reasons. The second reason is that I'd be able to continue going to school. I completed high school with a 3.5 GPA. I'm currently in a bachelor's degree in cell and molecular biology. About to finish that after 8 years of doing part-time school. Just recently I finished a stem cell research internship while going to school almost full time and doing dialysis. So there's this huge amount of freeing up of my time that it has produced. It's given me the ability to continue to go to school, to continue to get my education. And then as I got better at managing my time, doing dialysis at night, and working during the day, I've been able to do more things. And it's just every step is a new step to independence. And that's the biggest thing for me. You're, not only will you be feeling better because you can ask your doctor to do more dialysis time, not only will you be able to eat more if you have that more dialysis time, but you'll feel better, you'll have more energy to go exercise or go, if you're elderly, hang out with the grandchildren, travel. If you're younger, you'll have more energy to go to school and get a job and do all of these things. And it doesn't stop there. Home hemodialysis is the best way right now that we have.
Let's move along to access. There are different ways that access to dialysis happens. A vascular access is the way blood goes out of your body to be cleaned. There are 3 main types: a fistula, a graft, and a catheter. Let's talk about each one of these in more detail. A fistula is where an artery and a vein are surgically connected to each other. Fistulas are usually placed into the arm. There are some pros and cons. The pros are that it's the best choice for access. There is less chance for infection or blood clots. It may last many years, and there is increased blood flow in fistulas. Some cons are that it may be visible in the arm from outside the skin. It could take several months to develop and mature. It may fail to mature and you might need another surgery. And not everyone is a good candidate for this kind of access. An AV graft is the next kind of access that involves joining an artery and a nearby vein with a small, soft tube made of synthetic material. It sits underneath the skin. Let's talk about some pros and cons of this type of access. Some pros include it can be readily implanted, it has predictable performance, and can be used sooner than an AV fistula. Some cons are there is an increased potential for clotting and infection, and it may not last long as a fistula. Finally, a catheter is the last type of access. A catheter is a temporary tube inserted into a large vein in your neck or chest. The ends of the tube sit on your skin outside your body. This type of access is generally used immediately when you need dialysis urgently or for a short period of time. Some pros are that it can be used in an emergency situation, it can be placed quickly and also used immediately. Some cons are it has the highest infection rates, may require longer treatment time, it can have inadequate blood flow, it has the highest rate of clotting, and tends to have increased hospitalizations. We know that deciding on a treatment for kidney failure is not an easy choice to make. Today we hope that you've learned a little bit more about your option for hemodialysis. Congratulations! You've completed the module on hemodialysis. Please check out our website for additional educational modules in this series on kidney failure and treatment options for failing kidneys.